Continue with Unit 16. This video includes Part D, white blood cells, Part E, platelets, and Part F, the lymphatic system. For white blood cells, we'll look at the types that exist, the origin of them, and their general function. White blood cells make up the second major group of formed elements in the blood. Among their general characteristics, about 5,000 per cubic millimeter are found. A much larger number of white blood cells are located outside of the circulation, because that's where they do most of their work. 3/4 of those that are in the circulation usually stick to the inside of capillary walls, called margination. They release many chemical mediators. Many have granules. These are lysosomes. They contain enzymes, other active compounds. Classification of white blood cells is based in part on the presence or absence of granules. Granular white blood cells have obvious granules. The agranular appear to lack the granules, although they are present but very small. Classification is also based in part on the stain that the granules accept. Granular white blood cells include eosinophils, a granule stained with an acetic, that is a red stain. Eosin refers to red. Basophils, the granules stain with a basic stain. They're similar or become mast cells. We'll come back to that statement shortly. The granules, as we said, are stained with a basic stain. It's kind of a purple-looking stain. And then there are the neutrophils, a granule stained with a neutral stain. It's also a purplish stain. Granular white blood cells have irregular shaped nuclei, so sometimes they're called PMNs, or polymorphonuclear white blood cells. Note that these cells arise from the bone marrow and mature in the bone marrow. Agranular white blood cells include monocytes, which become macrophages. They include microglia in the brain, Kupffer cells in the liver, osteoclasts in the bone, areolar macrophages in the lungs, and Langerhans cells in the skin. The lymphocytes, which are lymphoid white blood cells, are another category of the agranular cells. They become B cells that mature into plasma cells, and T cells that include helper T cells and killer T cells. Note that these cells arise in the bone marrow. Monocytes mature in the bone marrow, but lymphocytes mature in the lymph tissue. What about the origin of white blood cells? Well, white blood cell maturation is a complex process with many intermediate steps. It begins with hemopoietic stem cells that form cells called colony-forming units. We mentioned these a little earlier. These then become various types of precursor cells, intermediate cells, that develop into the 5 types of white blood cells. Leukemia refers to many diseases involving overproduction of various white blood cells. How many types of white blood cells and intermediates do you see in the figure? 26. How many different types of leukemias might result if one of these cells exhibited abnormal growth? 26. Let's look at the origin more carefully of these cells. Hemopoietic stem cells arise from embryonic cells, and interestingly enough, those same embryonic cells give rise to nervous system cells. So there's a link between the nervous system and the immune system. This might explain, in part, the placebo effect. 30 to 40% of all patients given a placebo, that's a fake medication, show improvement. White blood cells mature in two places. Myeloid white blood cells mature in bone marrow, in granulocyte MP forming units, and include eosinophils, basophils, neutrophils, and monocytes. The lymphoid white blood cells mature in lymph tissue from B and T progenitor cells, and they include the various lymphocytes. The functions of the white blood cells include, for the eosinophils, they ingest antigen-antibody complexes. They kill parasitic worms. Basophils release many potent substances. We call them vasoactive because they activate various characteristics of the blood vessels. Vasodilators, such as histamine, is one example. Another would be the anticoagulants, such as heparin. Heparin is a mucopolysaccharide, that is, it's related to polysaccharides. Other substances as well are released. It has been debated over the years about whether mast cells are basophils located in the tissues, or are they a completely different kind of cell. Well, I think now it's pretty well thought that mast cells are the basophils that are found in the tissues. Neutrophils carry out phagocytosis. The granules contain antibacterial enzymes. Monocytes become macrophages, which have two general functions. One is regulation, and the other is phagocytosis. As a frame of reference, we might classify them into wandering, those that are crawling around in the body, and fixed, those that are more or less fixed in place. Lymphocytes include B cells involved in antibody-mediated or humoral immunity, and T cells involved in cell-mediated immunity. Let's continue with Part E, the platelets. Then we come to the third group of formed elements. These are the platelets. About 250,000 per cubic millimeter are circulating in the blood. These are small, flat cells lacking a nucleus, roughly 3 microns in diameter. Remember, the red blood cell was 7.5 microns. Platelets contain actin and myosin, so they have an ability to contract. Many organelles, including granules, that secrete many substances. They have many different organelles. Platelets arise from hemocytoblasts. They become megakaryocytes in the bone marrow. These are huge cells with many nuclei. The megakaryocyte then fragments into thousands of platelets. Function of platelets is hemostasis. Now, what does hemostasis mean? Well, we might say it means clotting, but as you'll see in a moment, it's much more than that. But it does prevent loss of blood. It involves two opposing processes, clot formation and clot dissolving. These have to be in perfect balance for hemostasis to work. The requirements for hemostasis include adequate amounts of functional platelets, coagulation factors, coagulation inhibitors, blood calcium, and clot formation involves 3 steps. One is vascular spasm. 2 is the formation of a platelet plug, and 3 is blood coagulation. Vessel damage is the major event. Normally, endothelium is very smooth and prevents clotting. If the wall breaks, collagen is exposed to blood. When the platelets contact collagen and cell membrane phospholipids, platelets then release their contents. The vascular spasm, the first event, is a constriction of the vessel after injury. It's due in part to serotonin, the vasoconstrictor released from platelets, likely when they contact collagen. It's a local response of smooth muscle to trauma. It's also due in part to nervous system reflexes. The degree of trauma affects the extent of vascular spasm. The greater the trauma, the greater the spasm. The less trauma causes less spasm. So, when you cut yourself shaving, it bleeds and bleeds because the razor, being very sharp, caused very little trauma to the vessel. So there was little vascular spasm. But if you cut your leg badly, it doesn't bleed quite as bad, though it seems like it does. But because of the massive trauma, there's a lot of vascular spasm that occurs. The vessel breaks, the platelets become sticky. This is due to ADP released from the platelets, as well as other factors. The clumped platelets, however, must not block the vessel. To plug the hole but not the vessel, platelets do not stick to intact endothelium. Platelets, though, stick to the collagen exposed by the break, and they contract. This is the clot retraction due to the presence of actin and myosin in the platelets. The platelets continuously repair small breaks in blood vessels. If platelet levels decrease, petechial hemorrhages result. These are tiny pinpoint areas of bleeding. Blood coagulation is a complex series of reactions that forms a clot. Clot is a gel. Now, the clot is not the same thing as a scab. It's initiated by two groups of factors. Extrinsic factors, including the vessel walls, these are outside of the blood. And intrinsic factors, these are activated within the blood. The extrinsic factors include membrane phospholipids, like one called factor 3 or tissue thromboplastin. There are various other substances released from damaged cells in the vessel wall or damaged tissues outside of the vessels. The extrinsic factors may be due to injury, surgery. Inactive plasma proteins are then activated. A series of reactions takes place. The extrinsic or intrinsic factors activate the cascade of reactions among the plasma proteins, which leads to the activation of prothrombin. Prothrombin is activated to thrombin. Prothrombin is made in the liver. It requires calcium for its manufacture. It functions to increase platelet aggregation and secretion. It requires vitamin K for its manufacture. Vitamin K is required for other clotting factors. It's made by intestinal bacteria. It's fat-soluble, so it's absorbed with the aid of bile. Fibrinogen is activated to fibrin by the thrombin. Fibrinogen is also made in the liver. By the way, if you're ever asked on a question, where is such and such a protein made, and you have no idea, guess the liver. That's usually a good guess because so many proteins are made in the liver. Fibrin, when it's formed, then develops links, causing the threads to develop and link together, increasing the strength of the clot. Each step in the clotting reaction is magnified in the next step. Clot dissolving, fibrinolysis, occurs with these substances. Plasminogen, or profibrinolysin. It's a plasma protein. It's activated to plasmin by factor 12, TPA, tissue plasminogen activator. This is released from endothelial cells. Also, lysosomal enzymes are released from damaged tissues. Plasmin dissolves the clotting factors and digests fibrin to break down the clot. It's incorporated within the clot. Anticoagulants prevent clots from forming, mainly by deactivating thrombin. Antithrombin 3 is a protein produced by the liver, a powerful deactivator of thrombin. Heparin, secreted by basophils and mast cells, combines with antithrombin 3 to deactivate thrombin. The purpose of clot dissolving is to prevent the clot from spreading. Without clot dissolving, the clot might spread throughout the body, clogging vital vessels and leading to death of tissues. So blood hemostasis is a carefully coordinated series of events to stop the loss of blood without stopping the flow of blood. Let's look at vessel obstruction. An embolus is a moving obstruction. This may be due to venous thrombosis, that is a clot in the veins, which breaks loose. Fat, air. Air may accumulate in the right side of the heart, and this would impair the flow of blood because air compresses. You'll understand more about this when we get to the cardiovascular system. A venous thrombosis is a stationary clot, often occurring in the legs. This is due to slowing or stasis of blood, which fails to dilute the thrombin, so it tends to form spontaneously. It's due to prolonged bed rest, varicose veins. It may result in the release of coagulation factors after surgery or tissue injury. If the clot breaks, it may lodge in the pulmonary arteries. This would be a pulmonary embolism. The lungs normally act as a filter to remove small clots from the blood. A large clot, however, will block flow to the lungs and decrease blood flow to the other organs. An arterial thrombosis may occur. If it occurs in the coronary vessels, it's called a coronary thrombosis. It may be due to a fat buildup on the vessel walls, atherosclerosis, damage to the heart chambers and valves, congenital conditions, and bacterial infection. A coronary thrombosis treatment includes using streptokinase. This is a clot-dissolving enzyme. It has to be administered carefully because treatment may cause bleeding, even from small scratches. TPA, tissue plasminogen activator. This can be administered to activate the plasminogen. Let's continue with part F, the lymphatic system. The parts of the lymph system include lymph, the fluid. It's very similar to interstitial fluid and plasma. Lymphatic vessels. These include tiny lymphatic capillaries and larger lymphatic vessels. They're similar to veins and they contain valves. One of them is the thoracic duct. It joins the left subclavian vein to return lymph to the blood from the left side and lower part of the body. The right lymphatic duct joins the right subclavian vein to return lymph from the upper side of the body. Lacteals are found in the intestines. They contain chyle, a milky fluid containing fat. Cisterna chyli, these are sac-like vessels found in the abdomen. Primary lymph organs include bone marrow, the site of B-cell maturation, and the thymus, the site of T-cell maturation. These are both very important organs, which we'll address again in the next unit. Among the parts are the secondary lymph organs. Lymph nodes, we sometimes call them glands. They filter material from the lymph. They're surrounded by a capsule. The spleen is another secondary lymph organ, Actually, it's also part of the cardiovascular system. It contains two kinds of stuff: red pulp, containing blood-filled spaces, and white pulp, containing lymphocytes and macrophages. Tonsils filter material from the lymph. They include the palatine tonsils, pharyngeal tonsils, we commonly call them adenoids, and the lingual tonsils. Peyer's patches. These are found in the intestinal wall. Let's look at the functions of the lymphatic system. One function is to return fluids to the blood. Roughly 2 to 4 liters a day are returned. Now you may wonder, why are fluids needing to be returned to the blood? Well, they tend to leak out, particularly in the lower extremities. You'll understand this better when we discuss the cardiovascular system. Failure of the lymph to return the fluids leads to edema, that is, swelling. Lymphatic capillaries absorb fluids from the tissue spaces. Another function is to remove germs and tissue fragments from the body. The germs include bacteria, viruses. In addition, cancer cells and fragments of other cells and tissues. The mechanism of this process involves mainly the lymph nodes, but of course the other organs are also involved. Let's use the lymph node as an example. Lymph flows into the lymph node by afferent vessels, they're at the lower part, and out through efferent vessels at the other side of the node. Lymph flows through channels, sinuses, within the lymph node. Macrophages are attached to the walls of these sinuses. The macrophages reach out and grab the impurities that are flowing in the lymph and remove them in a form of filtration. Another function is transport of absorbed fats from the small intestine. We'll come to that when we discuss the digestive system. Yet another is to make lymphocytes. The spleen has certain special functions. It makes red blood cells in the embryo, for example. It also filters blood to remove impurities. It also stores blood, so in a way, the spleen acts as a blood reservoir. The mechanism of lymph flow, well, first of all, as we mentioned, the vessels contain one-way valves to prevent the backflow of lymph. The skeletal muscle pump is one factor. When a muscle contracts, it gets fatter. When that happens, it squeezes adjacent vessels. This increases the pressure of the lymph, and the lymph then flows from high pressure to low pressure through the open valves, as indicated by the red arrow. The respiratory pump is another. It's a negative pressure created in the thorax while breathing. We'll address this in detail when we get to the respiratory system. Contraction of smooth muscle in the lymph vessel walls also contributes to movement of the lymph. And that's the end of blood and body fluids. So let's progress on to Unit 17, the immune system.